Hello, everybody. Welcome. We are live, running a little bit behind schedule, but per lowdown style, I got people to see, and we're gonna just, like I said, dive on in today. So thanks so much for joining me. If you're joining me live, if you're watching the replay, welcome. We're going to be really taking our time today to talk about a very relevant and very popular yet possibly polarizing topic, which are my favorite, right? We're going to dig right into the nitty gritty. Let's skip the small talk and the pleasantries and let's just dive right in. And you guys, like I said, know if you've been around here that I like to really talk about a lot of relevant topics and information that come up in more of the holistic health, the functional health space, because I know it's a little bit of the wild, wild west out there. And I think one of the more common and popular topics that has come up, at least in the last year in this space, has been around a lot of the insurgence of weight loss medications, right? If you are a little bit unfamiliar or new to a lot of the weight loss medications, I'll do a little bit of a deep dive on like the background of them, a little bit of the mechanism of action for them, because again, I want this to kind of feel like a conversation that's directed a little bit more towards my practitioners out there and peers. Don't worry if you're more in the patient space and curious about this topic, that's okay. You're going to get a lot of really relevant and takeaway information too. But I think more than anything, having worked with a lot of these weight loss medications, or some people refer to them as weight loss peptides in the space, I've seen the good, the bad, and the ugly. And I feel like there's a lot of relevant information to share and some essential considerations that I want other practitioners to feel really confident in, because I don't think that this space is going away. I don't think these medications are going to get any smaller in number. In fact, I think they're going to continue to grow and grow. And I think their use of them and their prescription of them is going to continue to become a bigger part of kind of the health and wellness conversation, right? So I want to make sure that we all feel really well versed in how to work alongside them, versus I think sometimes in this, maybe someone might call it more functional, holistic, alternative space, there's such a divide in terms of like, I guess you could call it like a moral compass around them. And there's these two camps of just like, we're either for them or we're against them. And these two camps are pitted against each other. And I'm telling you that as a practitioner in this space, I think it's very important that we have a more neutral conversation around it, and that we know how to work alongside these medications, because I think in the right situation and for the right person, they can be very beneficial. Like I said, I've seen the good, but then I've also seen the bad and the ugly, and things that we are not considering in this space at all. And that's what I want this conversation to kind of function as today. So if you're a practitioner, hold on for the ride, because we're going to get a little bit sciencey. We're going to get very specific. And if you're more in the patient-facing space, that's great too, because this will offer you some options or to kind of bring up with your practitioner and provider to make sure that you find somebody that you feel like is a good fit to be administering and coaching you through these medication usages as well too. So weight loss medications, right? Really big umbrella term. And underneath a lot of the weight loss medications, like I said, you're going to hear terms like anti-obesity drugs. You're going to hear things like weight loss peptides. We're all just referring to the same system here. And most of them are going to be revolving around what are called GLP-1 or GIP agonists, meaning they function similarly to our body's own natural GLP-1 or GIP hormones. So GLP-1 stands for glucagon-like peptide 1. Those are satiety hormones that are secreted in the gut, specifically in the upper part of the small intestine, in response to food. Right? So once we eat, and specifically like certain types of foods, are we shocked to figure out that proteins, fiber, and saturated fats tend to be the most largely what do I want to say, activating for GLP-1. So when we eat a good, high quality, nutrient dense diet, we produce more of these satiety hormones in response to food. The satiety hormone travels from the gut to the brain and shuts off a lot of those hunger cues. So we feel full and satiated for hours, right? So you can imagine that these satiety hormones in individuals that don't necessarily eat a very high quality or nutrient dense diet probably are lacking, right? And so therefore their hunger and fullness cues are very different than a normal functioning metabolism. They tend to feel more hungry. They aren't as satisfied by their meals, so therefore they eat more and may struggle with more body composition issues, right? So we're kind of talking about, like I said, these weight loss medications being more in the GLP-1, GIP type family. They are satiety hormones. They shut off the hunger fullness cues within the brain. The second mechanism of action that they have is also, especially at higher levels, GLP-1 and GIP also slow gastric emptying, which is really just a fancy way of saying how quickly food is leaving the stomach and emptying into the small intestine, large intestine, and those lower digestive organs. So at more physiological levels, the levels that we produce naturally as humans, you're going to get some of that nice delayed gastric emptying, right? Food exits the stomach and drips into the small intestine at a nice steady pace, and that leaves you full for hours. It also maximizes how well you are absorbing your food because it drips in nice and slow versus just dumping into the gut, and now we have malabsorption issues or maldigestion issues. And so you can see both sides of the situation here where these hormones could be very powerful for appetite suppression, right? You're like, oh, okay, so these weight loss drugs are literally mimicking some of the same satiety hormones that we produce in our body and help the brain feel full, as well as delay gastric emptying, which makes us feel fuller for longer, right? It's like, yes, they do. At the low physiological doses, they do this very naturally. At higher, what we call supraphysiological doses that are coming from these medications, we get very potent responses, right? We get very slow or delayed gastric emptying, and we get very potent appetite suppressants to the point where a lot of people who are on these medications and maybe utilizing them at more higher dosages, they don't eat, right? So you can imagine they do result in very quick weight loss, which then we see the highlight reel on social media of people being like, I lost 30 pounds in 30 days, right? I feel fantastic, all of this good stuff, right? So not saying that, like I said, there's not some good mechanism of action here, but definitely want to understand how they work so that we as providers understand how to work alongside these types of medications. So most, like I said, of the common classes are going to be your GLP-1 receptor agonists, which include things like semaglutide, if you've ever heard of that term. In a brand name perspective, semaglutide is marketed as Ozempic or Wegovy. And then you also get another class of the GLP-1 and GIP agonists that are part of the Tirzepatide family, which is more your Mounjaro, your Zepbound kind of families. So we get lots of brand names, we get lots of generic names coming into the mix, but know that a lot of times these are prescribed to patients that are in an obese demographic, right, which is defined as a BMI over 35, right? So you go back to your weight divided by your height, right? We're going to be able to calculate somebody's BMI and put them into a certain risk categorization sector, right? So a BMI in the obese category and or individuals that struggle with type 2 diabetes. Those are usually the two primary criteria. Now, what's happening though is we're seeing lots of individuals that don't necessarily meet those criteria markers, and they're still utilizing a lot of these weight loss medications, usually more from like boutique med spas, standalone longevity clinics, right? Where individuals are getting a hold of these medications, even if they don't necessarily qualify from an insurance coverage standpoint, they can get them prescribed under compounding pharmacies, even if they don't necessarily meet the standard criteria for who they were designed for, right? So there's lots of, like I said, weight loss medications that kind of target appetite suppression, reward centers in the brain, delay gastric emptying. And while these drugs can yield significant, that was cool, my phone fell. While these drugs can elicit significant weight loss in the short term, I think that there's, like I said, a range of potential side effects and things like that that are continuing to be under scrutiny. So even if we kind of like look at some of the highlight reel, I want to share with you guys from a practitioner standpoint, what are some of the things that I've seen behind the scenes of individuals that have done really, really well on these types of medications and why they've done really well. And also some of what I call the dark side, dare I say it, of some of these weight loss medications that nobody's really talking about. And so then when I get patients in here that don't have a great experience with these weight loss medications, they feel very, very ostracized, right? They feel like they're the minority. They feel like something about them is broken because they didn't get the same success as what they saw on social media. Or they just feel like nobody else had this type of response or type of reaction to them. And a lot of times I tend to be then the first person that's telling them, I'm like, no, like your experience is not abnormal. The hard part is all you're seeing is the highlight reel on social media. Nobody is shedding light and talking to those individuals that aren't having a great experience or had a good experience at first and now they feel stuck. Right. And that's really, I think, where my heart goes out to is the individuals that feel on the outside and aren't getting the right attention that they deserve of how do we get them out of that predicament. So as health professionals, I think it's very important that we strive to provide solutions that improve not only someone's short-term outcomes, because it is important that we gain motivation, we gain momentum, but also we have to think about long-term health and vitality here, right? So these medications, sometimes I question, I'm like, for certain individuals, are they doing more harm than they are good? And so I really want to, like I said, dissect some of the hidden risks to some of these quick fix kind of approaches, and how they're impacting not just the physical health of individuals, but also mental health, emotional health, etc. Right? So I really kind of want to start off by even just diving into, like I said, some of the hidden dark sides from a physical perspective, because I think some of these things are ones that maybe you have heard about and we can shed some light on. So from a physical health standpoint, we are thinking about what we call metabolic disruption for individuals. So weight loss medications, particularly some of these more GLP-1 receptor agonists like semaglutide, they can interfere with overall metabolic processes, meaning they can slow our metabolic rate. They can lead to a lower resting metabolic rate, especially when we have really rapid weight loss and a lot of that coming from muscle tissue. You have just then, yes, made yourself lighter on the scale, but you've also markedly reduced how much energy your body is burning at rest, which is the classic example of what they've studied on individuals that participated in things like The Biggest Loser. Right, they found that these individuals did have very rapid weight loss, but now their body is compensating, right? So now their body like burns less energy at rest. And so therefore, in order to continue to lose weight or maintain the weight that they lost, it is a very drastic and kind of extreme approach in order to maintain that, right? So the slower resting metabolic rate, the loss of muscle mass, obviously something that's not going to bode well from a long-term vitality standpoint. You think about strength, independence, bone density, all sorts of good stuff. So there was a study published in Obesity Reviews that found the rapid weight loss from these medications often results in about 25 to 30% weight loss being from lean muscle mass rather than fat, which does really raise a lot of concerns just for long-term metabolic health. Obviously, too, one of the other physical concerns that I think about is nutrient deficiencies, right? So one of the classic examples I like to give to my patients is a lot of times when individuals are on some of these more appetite regulating medications, maybe the dinner that they were eating before was like steak and broccoli and mac and cheese, right? Well, now that their appetite is smaller and they get fuller on a very small amount of food, they tend to then just eat the mac and cheese, right? Like that's just human nature. And they didn't realize, they're like, oh yeah, I'm kind of pushed out some of the other pieces. I'm not saying that that's everybody's experience, but I'm saying that that is a large majority individual's experience of just eating less, but not necessarily paying attention to like what they're filling that smaller appetite with. So obviously we're getting insufficient caloric intake, which is kind of the point, which leads to a lot of nutrient deficiencies, especially vitamin and mineral deficiencies, protein deficiencies for sure. And according to a report that they followed individuals utilizing these weight loss medications this was from the American Journal of Clinical Nutrition, chronic undernutrition due to appetite suppression increased the risk in these individuals of things like osteoporosis, anemia, especially in more older adults as well too. And I know how many, especially like menopausal women, are being marketed these weight loss medications who are already in a higher risk stratification category for things like osteoporosis and nutrient deficiencies. So it could be something that continues to kind of exacerbate an already at high risk population as well too. Other physical characteristics here, we're seeing digestive issues, right? As you can imagine, at these super physiological doses of these hormones that delay gastric emptying, you're getting nausea, you're getting diarrhea, you're getting constipation, you're getting even worse, you're getting people that are being hospitalized for gastritis, pancreatitis, bowel obstructions, right? Like it gets to that point because we're literally paralyzing the gut. Sorry, I know it sounds extreme, but like that's what we're doing. Clinical trials of semaglutide did report up to 20% of participants having to discontinue treatment due to severe gastrointestinal symptoms. And if you hit up like any Facebook forum out there that's talking about these, there are definitely individuals out there that will not be shy about sharing their stories of like hospitalizations or issues that flared up when they started some of these weight loss medications. Now, my caveat here is most of the time individuals that struggle with their weight have pre-existing gut issues. Right? So that does, I'm going to just play like devil's advocate here. Yes, I think some of these medications are exacerbating gut issues. I think they're exacerbating gut issues that were already there. And that's usually why individuals are struggling with their weight in the first place, is because they have gut issues that they don't necessarily know about, because the microbiome plays a huge role in metabolic health and plays a huge role in individuals who are struggling with weight loss resistance. So I think what's really happening is individuals are struggling with their weight. They're trying diet after diet, exercise program after exercise program. They're not getting success. They go to their doctor, who then immediately puts them on these weight loss medications. And actually, the root cause of their issues was probably more microbiome and gut related. And so then you like put a match onto a fire that's already burning and like poof. So that's where I think we're getting some of those maybe inflated numbers coming from the digestive situation, because my bet would be that a lot of these individuals are struggling with their weight because of their gut health. And now we're putting something in there that just kind of exacerbates what already was pre-existing. Then also, like, you know, you think about just like long-term risks as well too, of like, because of the gut health issues or because of the nutrient deficiencies. Like I said, you start to think about bigger picture things: bone mineral density, cardiovascular disease, type 2 diabetes. Like you just think about all of those types of things that happen from more of those like physical health characteristics. So to me, I want to at least shed a little bit of light on some of the physical things that prevent people from having a great experience with these weight loss peptides, or some of the physical, dare I say, like side effects of utilizing some of these medications. But to me, it's kind of funny because the physical side effects aren't even the thing. right? Nausea, bloating, gas, digestive issues, like nutrient deficiencies, like I lost a bunch of muscle mass. I'm like, yeah, those are very real and people are talking about those. But I think the bigger thing that concerns me for sure, being more of a mind-body oriented practitioner, are the mental and emotional impacts. I literally had a gal last week who I've been working with now for a while. She's been on Tirzepatide for about a year and a half. She did lose about 40 pounds on it. And now to this day, she says, she's like, I feel like I have an eating disorder and I've never struggled with food in my life. Oh, now she's coming to the table and she's like, I literally have an eating disorder. And I have not heard this, or I've heard this from multiple individuals who now what happens is after being on some of these appetite suppressants, I'm literally seeing individuals who are scared of feeling hunger. Kid you not, right? They're like, crap. Oh no, like I'm feeling hungry. I'm like, excuse me, that's normal. That's like a healthy thing. We want to experience consistent hunger cues because that tells me that the metabolism is moving. It tells me I'm eating energy, I'm digesting energy, I'm absorbing energy, I'm excreting energy. It's in, it's processing, it's assimilated, it's out, right? It's like someone that's not hungry, it's like that is a metabolism that is under stagnation, it is hoarding, it is not doing good things, right? And so to have individuals that literally feel handcuffed now to this drug because they're like, I tried to titrate off of it or I tried to do a little less and like I felt hungry. And I'm like, yeah, right? But the hard part is people are just on these medications without working with someone like myself or other functional practitioners out there. They're not guiding them on how to use it correctly. And so it's like, hey, if you feel hunger, this is how we want to fill that hunger and feel confident about, hey, if I experience hunger, that's okay because I know exactly what to do with it, right? That to me is like the bigger issue here, right? We have a lot of individuals that are like, there's like body image distortion going on. The rapid weight loss here can reinforce like a really unhealthy relationship with body image, perpetuating disordered eating behaviors. A pretty recent, a 2023 study out of psychosomatic medicine found that 40%, which is really high, of patients utilizing weight loss medications reported heightened body dissatisfaction post-treatment, despite weight loss. Wild. 40% of people, they get to a certain place and they're like, oh, this doesn't feel like I thought it was going to feel. My body looks different than I thought it would look at this weight. It's like, yeah, because you lost it like kind of the wrong way. You lost it very rapidly. You lost a lot of muscle mass in the process. So like, it probably wasn't going to bode well for overall outcomes, right? Also, like I said, the mental health risks that we're talking about here, emotional roller coasters of weight loss and plateaus and rebounds, like it can really exacerbate anxiety, depression in these individuals as well too. And you just lose this complete connection and trust with your own innate body wisdom. Like I said, it's like, do we know how to feel our normal hunger and appetite cues and feel good about that? Because we know exactly like, hey, what do I fill it with? How do I connect with foods that leave me feeling full and satisfied and energized for hours, and focusing on how food makes me feel versus how food makes me look, right? It's like we lose all of that entirely. And so for individuals, like they really feel handcuffed to these medications because they try to get off of them, and all of a sudden we're seeing like them having like a risk of rebound weight gain, right? Because their appetite is coming back to normal. They don't necessarily know how to fill it. They've lost all this muscle mass. And so it's like, I think the biggest concern is let's say someone goes from 200 pounds to 150 pounds. Well, at that rate, you lost fat, but you also lost muscle, right? Let's say worst case scenario, you regain that 50 pounds. You're not regaining muscle. You're going to regain all body fat. So not only do you end up back at 200 pounds, you end up back at 200 pounds fatter by percentage than you were before. That to me, I'm like, okay, what are we doing here, right? It's like there just has to be a more complete or kind of, like I said, holistic picture, because don't think that it's not intentional that you start these medications and there's no exit strategy. That is very intentional, right? Don't think that it's not, because there's like follow the money behind these situations. So it's like, oh, you start this weight loss medication, you lose a bunch of weight, and now it's like, now I feel handcuffed. Like I feel like I can't get off of it because what if I gain weight, or I can't get off of it because what if I feel hungry? And it's like there's so much psychosocial that goes into it, even well beyond a lot of the physical ramifications of it as well too. So I just want to kind of, like I said, really bring to light and highlight that, because I don't think a lot of people are bringing that to the surface, not to mention the individuals that I've talked to that, like, oh my gosh, I swear, I'm going to get through this. Individuals that I've talked to that don't tolerate it well and can't even stay on it long enough to see weight loss because of, like I said, a lot of the underlying, more often than not, it's the individuals that have underlying gut issues that aren't tolerating these things well, or are having kind of the biggest reaction to them, right? So they feel like they're in the minority, when in reality, I'm like, no, like your experience is not in the minority. In fact, like there's a lot of individuals, we're just not talking about it. And that's the problem, right? So before my phone falls again, because it's being a little bit of a Debbie Downer on me today, let's really go high level. I just want to kind of address, like I said, this practitioner situation and really talk about high level. How do we work alongside these? I'm just going to hold it to mitigate some of these like potential side effects, right? So number one, we as practitioners absolutely have to have a way to screen for gut issues. Right? That's going to be the number one thing. So if you're a practitioner out there that is already working with functional medicine testing, things like GI map tests, things like gut zoomer testing, then that's going to be a really great screening tool for you, or like organic acid testing. That's going to be really, really helpful, because these individuals probably aren't going to tolerate the medication very well, or are going to have more side effects if they have bile issues, they have low stomach acid, they have poor beneficial bacteria. Like there's probably going to be some situations here, or if there's just an overall like high toxicity burden, that's going to be something that's going to be a limiting factor. So definitely screening for gut issues. If, like I said, you're a practitioner and you don't necessarily have that in your wheelhouse yet, we have some opportunities to get some mentorship from me coming up soon, which is super exciting. The second thing that we really need to be thinking about too is monitoring for nutrient deficiencies very closely. I think this is a two-way street. Thinking about like, yes, supplementally, we can kind of come in and close some of those nutrient gaps, but also through food. Right? These people need to be working alongside a nutrition professional that is monitoring things like their mindset around food, their overall nutrient intake. I always tell people, I'm like, if we're going to utilize these medications and your appetite goes from here to here, I need you to be more picky about what goes into that smaller appetite, not less picky and just be like, oh, it's fine. I'll just grab some Cheez-Its. I'll just grab some almonds. Like, I'm not super hungry. I'm like, no, we need to be very discerning of like what goes into that smaller circle then, right? We also need to make sure that we're putting them on a plan to help preserve muscle mass. I think this goes back to protein intake for sure, as well as making sure that they are engaging in consistent muscle stimulation, whether that is ideally weight-bearing exercise like resistance training. Very, very important for sure too. And then last but not least, we need to be thinking about providing emotional and mental support as well. If that is involved in your container, great. If that's something that you need to resource out for, don't hesitate to resource out for that as well too. But really making sure that as these individuals are going through this process, they are, like I said, losing weight in a more sustainable way. And not like really rapidly losing weight, but being okay with I mean, honestly, I don't like my people pacing more than a pound a week. That to me is like half a pound to a pound a week. That's the most aggressive that we can really go and still maintain muscle. So making sure that we just wrap them up with a lot of expectations, right? Of like what a successful journey is. So that way they're just not comparing their journey to someone on social media and be like, well, she lost 30 pounds in 30 days. That's not always something to celebrate. That's okay, right? Like that's not always the win. That sometimes is not successful because it's like, what is her long-term outcome of that? And then also making sure that on these weight loss medications that we're preserving the victory of hunger and fullness cues, and that they're still practicing things that help them learn how to eat mindfully, slow down, chew their food really well, connect with how their food tastes. And like I said, just be very discerning of not only what they're eating, but how they're eating as well too. And so, like I said, that can look a lot of different ways for individuals, but I think as practitioners, it's very, very important that we have a little bit of next level screening, because these weight loss medications, they're not going away. They're just getting handed out, honestly, like candy. It's very simple for individuals to get a prescription for these anymore, whether or not they meet certain BMI criteria or type 2 diabetes criteria, right? So they're going to continue to grow in popularity, and being able to screen for gut issues, being able to monitor nutrient deficiencies, being able to preserve lean muscle mass, and also be able to really coach them through the emotional and the mental part of it and set their expectations accordingly can be the difference maker between a positive or negative experience with these types of medications. So that's just, like I said, sharing a little bit of high level thoughts behind the scenes, knowing that, like I said, I see a lot of individuals who are either not getting the same success as other people and feeling like a failure, which is not accurate. Like the stories of people having different experiences than just the highlight reel need to be talked about. Absolutely need to be talked about. And then also making sure that we're addressing I had good success initially, and now I feel stuck and feel myself progressing towards body dysmorphia, feel myself progressing towards disordered eating, feel myself progressing towards a poor relationship with food. Those are the populations of people that I want to just shine a light on, because those are the people I'm seeing in my practice, not the highlight reel out there, right? And I think they deserve to have someone that's advocating for them, because it's hard for them to advocate for themselves. So as fellow practitioners and peers out in this space, I encourage you to also be a really safe landing space for those types of people as well too. So be on the lookout for more opportunities to dig into some practitioner mentorship. I'm going to be announcing some fun things in 2025. So thank you for being here, and thank you for putting up with some of my technical difficulties today, and have